Hi everybody, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to continue my series on workflows, and I did one on referrals, and now I want to talk about prior authorizations. Prior authorizations are a big headache in an office, but it is a reality and it's something that needs to be established before you open on who is going to be helping obtain those prior authorizations when they're required. Prior authorizations are required for medications as well as diagnostic imaging and sometimes a few other things depending on the insurance plan. So it is something that is going to occur and be required in your office at some point, no matter what your specialty is or your focus. So it's good to make sure that you think this out and put policies and procedures into place for this. My suggestion, just like the referrals, is to find out if your EHR system helps with any kind of tracking of prior authorizations, and also if you need to have a prior authorization for billing out a service where there is a place to put the authorization number when the claim is submitted so that it will be covered. That is a huge part, and a lot of people forget about that or don't know about that. But if you're billing out a service in your own office that requires a prior authorization, a number is assigned when it's approved for a certain time frame, and that needs to be associated and sent with the claim so that the insurance can see that it was approved. They can look up the approval by the number and make sure that the services were rendered within that date range in order for them to cover it in the way that they need to based on the patient benefits. There are a few things about prior authorizations. One is, depending on the insurance company, depends on how you obtain those prior authorizations. A factor is what kind of prior authorization is it? Is it for getting extra visits for a physical therapist? Is it a prior authorization for a medication that's non-formulary? Or is it a prior authorization for advanced imaging? Now, a lot of insurance companies use a third party, and they have a portal and or a phone call that you can make, but usually the portal is the most efficient way that you submit authorization for advanced imaging. In order to get advanced imaging approved, there are quite a bit of criteria that are set, and it's all individually set by each insurance company, but there's some general consensus, if you will, of what is required in order for advanced imaging to be approved. Some of the information that needs to be provided when your staff member is applying for the prior authorization is exactly which advanced imaging you're wanting and if it's with or without contrast. Sometimes they ask for the CPT code associated with that specific service, diagnosis codes, any kind of therapies, conservative, that have been tried and failed, and what dates those were tried and failed, symptoms, of course, and the reason that you want to have the advanced imaging. And I know some of this sounds like it's the same thing, but trust me, they ask all this information. They'll also want to ask for the imaging facility, the location by like address, the name, and making sure it's an in-network facility for the patient. Then if it's approved, a lot of times they'll give you like a month's time span in order to give the patient time to get scheduled and get that done. So, make sure that your staff is aware to pay attention to that as well. Now, if they have to obtain a prescription authorization, sometimes they can use Cover My Meds, which is a great universal website, and if you haven't heard of it, you should look it up. Each staff member creates their own Cover My Meds portal, and they can submit right through there to whichever insurance company, and they have special forms based on the insurance company and the medication that they would fill out. They would also want to attach any chart notes, so you want to make sure with all prior auths, no matter if it's a medication, extra visits, or advanced imaging, that you make sure that in their last office visit that you have documented everything that I'm talking about that is needed to apply for the prior auth. So you want to talk about conservative therapies that were tried and failed. You want to talk about any kind of medications if it's for a medication authorization that they have tried and failed for the same condition, or if it's still not controlling certain lab numbers like a diabetic, giving those examples. A lot of times it's helpful to submit those chart notes and those lab results with the submission of the form, so make sure it's very well documented. For extra visits, you have to explain why extra visits, like if they have a stalemate in their treatment and progression, or if you still need to have some visits to explore other treatment options. I mean, there's so many different reasons, but you want to make sure everything is documented appropriately. It also helps your staff member fill out those forms and those questionnaires when they're applying for the prior authorization, and it shows the consistency when it's submitted with the chart note and the application or the form, that it's all coherent and they won't have a lot of questions, hopefully. The cleaner and more information you provide, hopefully the faster you will get or obtain that authorization for the patient as well. Now the big thing is who's going to be obtaining the authorizations in your office. Yes, you could have your back office do it, especially in the beginning if you just opened and they're not super busy because you don't have a high patient volume, but I would not suggest your front office doing prior authorizations unless the staff member has some sort of clinical background. There are a lot of things clinically with information that needs to be provided and provided thoroughly and clearly in order for authorizations to be approved, and putting someone in charge of that doesn't have the knowledge base is not good for your patient or yourself when it comes to efficiencies, workflows, and you're kind of setting them up for failure. Also, the longer it takes to obtain that authorization, the longer the patient is waiting, and you don't want that either, especially if it's delaying care or treatment, which usually it is. If you have the money and you have budgeted to hire someone specifically to do referrals and authorizations, that's amazing, but that's not most likely because usually you're going to be open a while, have a higher patient volume, and a demand that will cover that extra cost of wage for the staff member to focus on that. So most likely it's very reasonable to expect your front and back office staff to wear multiple hats, and that includes obtaining prior authorizations. If your back office staff has never had to do authorizations because they come from a large corporation where there was a set department to do that, they're going to need a little bit of hand-holding. They're going to need some trial and errors. They're going to need to ask questions. So hopefully you have someone involved that can help them with that, guide them, and show them so that once they get the hang of it, it will be not a problem. They're also going to have to be able to be granted access or obtain access to the different sites that I talked about. So the third-party portals that insurances might use, they'll have to create. They'll also have to know how to get on and create a portal through Cover My Meds. And they'll also need access to a lot of the insurance portals. Like some of the smaller insurances might have you obtain a prior auth through their portal and don't use a third party. The larger entities will have the third party, but a lot of the smaller ones won't, so they're going to need access to all of those different sites and know how to use them. Hopefully you have someone in your office that has experience with this that can help them, whether it's another medical assistant or nurse or a manager, but somebody's got to be there to help them because most likely you probably don't know either, but this is something that does need to be figured out and established before you open. I encourage you to put policies and procedures into place so that patients aren't being dropped or forgotten about, and that loop of communication is being closed because it's set out in your policies and procedures, and you're training your staff in expectations and what their roles are in obtaining authorizations, doing referrals, and all of that kind of gamut of a medical clinic. If you have any questions for me or suggestions, please leave that in the comments. Smash the thumbs up if you feel like today's video was helpful, and subscribe to my channel if you haven't already. I'm growing. I appreciate the support so much, you have no idea. And suggest my channel to any colleagues that you feel would benefit. Thank you so much. Stay healthy and take care of yourself. Bye-bye.